Liver produces about 600 to 1,000 milliliters per day of bile. The bile is being produced all the time. When we're not digesting, it's stored up in the gallbladder. Okay, when we are digesting, it's released into the intestine. More on that in a minute. Why? What does bile do? Two primary things. Number one, it's an emulsifier. Bile has the same properties as soap. Okay, it's like Dawn dish soap. Dawn dish soap takes fat droplets and breaks them into many small pieces. Okay, bile salts do the same thing. They're a classic surfactant, right? So they have a negatively charged, they have a polar end and a non-polar end. Okay, so that's primary or one of the roles, fat emulsification. This is hugely important. If you don't have a working bile system, you are not going to digest fats. You're going to have what's called steatorrhea, which is fat that comes out in the feces instead because you can't digest it. So more on that when we talk about fat digestion. The other important thing that happens from bile is waste excretion. Okay, so bile has a heavy lipid component. It's one of the few places in the body that we can put non-polar materials to have them be removed from the body. Okay, some of the medications and such that we give patients are non-polar. So the bile becomes one of the paths by which waste products are removed. So bilirubin is the most common one. Bilirubin is a breakdown product of blood, right? So old blood cells, when they're destroyed and recycled, we end up with bilirubin. It's actually, remember the heme molecule in the middle of the hemoglobin? Heme is very, very, very hard to break down. But when we hit it with a hammer hard enough, we get bilirubin, right? So bilirubin is what we end up excreting. The bile also is where we get rid of excess cholesterol and then, like I've said, some medications. So like in our efforts to reduce patients' blood cholesterol, one of our tricks is we give them a statin. The statin medication tends to increase the amount of cholesterol that's excreted, right? So reduce the body's cholesterol. Okay, so bile is secreted in two phases, all right? Initially, the hepatocytes produce a bile that has a large amount of bile acids, cholesterol, and the organic components, right? And then added to that by the ductal system is bicarbonate and sodium gets added, and that is, again, by secretin. So the pancreas is the primary producer of sodium bicarbonate, but the liver produces some too, all right? That's the second phase. And it works kind of the same as the pancreas. You know, like the pancreas, we produce these enzymes, and then the bicarbonate solution washes those enzymes into the intestine. Similar thing here. The hepatocytes produce the bile acids, and then the bicarbonate and sodium solution help to wash that into the intestine where they can do their job, right? So we'll talk more about the anatomy of the liver, like what's a canaliculi and that kind of thing when we talk either tomorrow or Thursday about it. All right, and then the gallbladder. The gallbladder does not secrete anything directly, but it is a storage system for the secretion of the liver, right, of the bile. So when bile is produced all the time, when it's not being used, in other words, when the sphincter of Oddi, when the papilla of Vater is closed, right, the bile produced by the liver backs up into the gallbladder where it sits and it's stored. Now, in the gallbladder, it doesn't just sit there unchanged, it's concentrated. In other words, the water is removed. So 5 times concentration compared to what comes out of the liver is typical, 20 times is possible, right? Now, this concentration, you remember from general chemistry, precipitation, right? Where if you put enough of a solution or enough of a reactants, you'll start to get solids that come out of solution, right? That's what bile stones are. As we concentrate the bile, as we pull water out, you can pull enough water out that the bile salts actually start to crystallize and precipitate. And that is a gallstone. Now, obviously, gallstones are not on purpose, right? The body would rather not have gallstones. Big ones are no big deal. Big ones stay in the gallbladder, never cause any trouble, right? It's little ones that are trouble because the little ones will leak out the bottom and then get stuck somewhere, right? So the big stones are no big deal. It's the small stones. So gallbladder concentrates. Now, when we need bile, okay, so when we start our stomach emptying, CCK stimulates the emptying of the gallbladder. So that bile that's sat in there and been concentrated, the gallbladder literally squeezes and pushes it out into the intestine. So that bile then enters and can participate in digestion. So CCK is the primary stimulator. Parasympathetic nervous system, acetylcholine, is sort of a secondary stimulator. All right, so I really like this picture because it shows you how this system works. All right, so here's the liver. It's producing bile. If this is closed, if the sphincter of Oddi is closed, then this bile can't get out here, so it backs up into the gallbladder. The gallbladder expands a bit, but it also concentrates, right? So more goes in than comes out because a lot of water has been removed. Now, when we start digesting, when CCK is released, the sphincter of Oddi opens, the gallbladder contracts, and now that material is pushed into the duodenum where it can start doing its job. Now, I'm sorry, I'm trying to find where I'm at. Okay. So the bile that's released when we're digesting, okay, is recycled. All right. The bile goes into the intestine. All right. Travels along with the foodstuffs all the way to the terminal ileum. At the terminal ileum, the bile salts are reabsorbed into the hepatic portal system, right? The hepatic portal system then delivers those bile salts to the liver, where they're pulled out and put back into the bile, right? So there's a recycling system. We call that the enterohepatic recycling system, where the bile that it enters the intestine is then reabsorbed into the portal circulation, goes to the liver, and then it's released again. So it sort of goes round and round and round.